these kids that I remember in high school. But Robbie retired with Santa Fe.
Santa Fe County Fire Department.
And then now he's working with Presbyterian Hospital, or the Presbyterian system, going around training at their different facilities. And he's a great resource. He also pitches in with the volunteer paramedics or ambulance service here, probably fire too.
Yes.
And so he's kind of not a real structured program, but just talk through and answer questions and maybe give y'all some advice on what you may need to do if you come across an accident on the ranch.
Okay.
So with that, Robbie Smith.
Thank you, Chad. So you guys, like Chad just said, my name is Robbie Smith. I'm retired from Santa Fe County Fire Department. I was a firefighter medic or fire paramedic for them for about 20 years. Since then, about 3 years ago, I went over to Presbyterian in Espanola. I ran some did some truck time over there in Espanola for a few years. Recently, I've kind of got tired of answering calls, is really the truth. And so I do continuing education for Presbyterian in general, going around to the different hospitals, clinics, getting the certifications that their staff needs, you know. And I do a lot of just quality assurance, quality education, stuff like that as well. I'm here, like Shad said, because he told me that you have this requirement or this need or something to just talk first aid, essentially. And if you guys are all out on ranches, out in rural areas, if something happens, what do you do? So my idea for this was just Q&A. Like if you have a scenario that you want to talk about, we can go through it and cover what you want. I was also informed that there might be a quiz, not given by me, but if there is going to be a little quiz or something, then I'm going to throw out some facts that might be on said quiz, like what to expect, regular pulse rates, how to find vitals. I brought my first aid kit. This is actually my personal first aid kit. If I or my family go anywhere, this is always with us. Even if we're kayaking, it's on the boat. So I always pass that around for people to see when we're doing just public education classes. So you can see that everything in there is purchased over the counter. There's no prescription, anything in there. There's nothing that's special to have. We'll put tourniquets on if you guys want, and we'll learn how to actually apply a tourniquet, how to make sure your tourniquet's working, what to do if you actually do go to the step of putting a tourniquet on, what indicates having a tourniquet, find out how to find pulses. We won't cover blood pressures because I don't think we have the kind of time for that. But we'll find pulses, respiratory rates, what's normal, what's abnormal, what to expect for head injuries, just things like that. And we'll just cover any questions you guys have and hopefully, have some fun spending an hour figuring this stuff out. Do you guys spend the night here or do you travel home wherever home is when you're done? Traveling, pretty much everybody. I mean, Corona's not near anything, so it's at least an hour no matter where you're going. So yeah, I still volunteer out here in this area as a paramedic because I'm the only paramedic until Moriarty. It's the next closest paramedic truck. So I will volunteer out here. Right now, does anybody have any questions for me or any ideas of what you would want to do or anything that's ever happened in the past? And you want to talk about how it went or what it went through or anything like that? Yes, ma'am. Okay, rattlesnake, that's a great one. So rattlesnake bites are a pretty big deal, right? They're scary and they hurt like heck. I would tell you, as somebody who's responding on a paramedic truck, first wear shoes when you go outside at night because that's when most people get bit. They're walking around outside near a lake, something like that, and they get bit, and they always get bit somewhere on the heel, somewhere on the foot. But I'm going to show you some devices you guys can buy and carry around for you, and they're like $20. I don't know, they're really cheap. We actually started carrying this one on meds in this state. Not every med, because it's not a PRC requirement, but some meds actually carry this now. This is called a bite sting kit. So if you don't have this, the first thing you want to do is keep the person calm, okay? Rattlesnake venom is what's known as a neurotoxin. So the faster their heart beats, the quicker that poison is going to spread throughout the system. But the good thing is that rattlesnake venom primarily circulates through our lymph system. So that's a slow process in terms of how fast we have to move, what's the greatest risk, okay? So 25% of all rattlesnake bites are what's called dry bite. In other words, 1 out of every 4 will bite you, but they don't actually inject venom into you. But if you're the other 75%, that sucks. The other thing is the venom itself is what's called extremely necrotic. Necrotic means if it comes in contact with that tissue, it destroys it, it kills it. There's no fixing it, there's no coming back from it. You'll have a surgery if it's bad enough to where they'll just scoop it out. They might do a graft, or they might just let the hole or the scar or whatever stay there, okay? So the first thing you do is keep them calm. That's huge because, again, that you have a 25% chance that you actually didn't get envenomated, okay? So that's the best thing. Second of all, keep the limb at or below the level of the heart. So you don't want to take your arm and raise it above their head. Does that make sense? And you do get bit on the hands because people do stupid things and they try to grab snakes or whatever. So keep that limb at or below the level of the heart. But keeping them calm, I can't stress that enough. Then thirdly, there's not a whole lot you can do at that point. They need an anti-venom, okay? The anti-venom, as we all know, comes from different sources, primarily from other rattlesnakes or horses that have been injected with the rattlesnake venom. Then we withdraw those cells, and that's how we get the anti-venom. Thing is, it's incredibly expensive and it's not super common. So there's specific areas around the state that have large supplies, and then there's other hospitals that just have enough to get the anti-venom in, and then they'll transfer you to another hospital that has more of it on hand. So keep the limb at the level of the heart or below, and keep them calm. Call 911, and we'll take it from there, because a lot of times what we'll see first, prior to tissue damage or anything else, is cardiac dysrhythmias. And we can treat those. If you have not every ambulance has a paramedic. Let's clarify that real quick. Everybody on TV is a paramedic, blah, blah, blah. In this state, and in most states outside of Tampa, Florida, most likely, unless there's a paid service that responds, you won't get a paramedic. It's very rare. Usually, and don't get me wrong, EMTs do a fantastic job, but it's not a paramedic, so there's certain drugs and such and procedures that they cannot do, they cannot perform. So call 911 as soon as you can, because when they get dispatched, if it's not a paramedic truck, they'll request it. So you've saved that 30 or 40 minutes that it would take before they get there. And the reason they're going to request it is because A, it's extremely painful for the person once the venom starts to spread, but B, when it starts to mess with your heart, we can give you certain medications to control those dysrhythmias and buy you time to get to where we can get you the anti-venom. Does that make sense? So call 911 too. That's also very important. But this you can buy, I buy everything on Amazon. Absolutely everything. So this is just called, has anybody ever seen these? They're just, all they are is they're just, and I'll pass it around for everybody to see, they're just little plungers. So you just put the little cap on, and you'll see it when I pass it around. It's got different sizes based on what venom you're trying to remove, but we're talking about rattlesnakes right now. So you put the little cup on, you just put the plunger on the part that's been bit, and you push down. And that's all it does, is it just holds that venom, hopefully, in that position to where we can slow down the spread of the venom itself. Does that make sense to everybody? You can get this like on Amazon or something. So yeah, pass it down, and you'll give yourself a little hickey, but that's okay. Play with it, use it, whatever you want to do. Yeah. So that's primarily what you do with rattlesnake bites. Since we don't know for sure that they're infected or they were injected with the venom, call 911. Keep the person calm, and then keep the limb at or below the level of the heart. Do not put a tourniquet on it. Did you have a question? Do not put a tourniquet. Don't try to stop the spread of the fluid or anything like that. There is a band you can use that's called the lymph restriction band, which is essentially is a tourniquet, but it's put on really light, because you're not trying to constrict blood flow. You're trying to constrict your lymph system, which is above that. Yeah, it happens all the time. What's that? Exactly, because you want to keep the injection site at or below the level of the heart. Make sense? You can put on ice packs and do all that, help with the local pain. You're not going to hurt anything, but obviously don't use it as a normal ice pack. Be aware that you could cause skin tissue damage as well, So, does that help answer your question? Okay, wonderful. Does anybody else have a situation or question? Yes, sir.
Extra water or liquid?
As long as they have control of their airway and they're thirsty, absolutely you can give them water. That's no problem at all. It's not necessarily a game changer. Like when we would get there, you would see us start an IV, but the reason we do that is less about the fluid and more about we might need to give them medicine. And so that's why we want that IV. But you can absolutely, as long as you don't worry about them choking on it or taking it into their lungs, it's called aspirating, then you can absolutely give them all the water they want. Don't give them alcohol. Because alcohol, the common term is that it thins the blood. Like people say aspirin thins the blood. It's an anticoagulant, right? So if you give somebody alcohol, they're less likely to clot, which inhibits their immune system's ability to respond appropriately. Okay? Does that make sense to you? All right. Any other questions? Yes, ma'am.
Is it harder on children than adults?
No, it's not harder on children than it is adults. What matters is the amount of venom that was injected into the person in general. Now, you will accrue more tissue damage in children because they have such a huge surface area compared to adults, but as in like the ability to recover and such, there's no difference at all. In the world, and I'm just going off of memory here, I think it's something like 600,000 snake bites in a year. Out of that, less than 500 people die. Out of that, less than 15 in this country every year. So it's super unusual for somebody to die. Now, the antivenom is incredibly expensive. It's literally $20,000 a vial. The last little girl I took in that got bit was actually up north in Rio Arriba County, and she took 6 vials before I left her I took her over to Espanola. We put venom in her there, antivenom there, and I took her down to UNM Peds, and she took 6 just to get to that point. So it's expensive. Wear shoes. It's a cheap solution, you know. Boots are great too, even better. Not Sanooks. Sanooks won't do too much for you, but wear boots.
What about the smaller ones versus the adult? Is there a difference of venom or anything?
Well, the dose would be different because it's weight-based. Like all intravenous medication, it's weight-based, and the weight base is in kilograms. So we don't want to slam them with, say, Oh, yes. The younger the snake in general, the more venomous it is. In fact, there's a huge thing going on. I don't know if you guys know this, but you guys should know this. In Texas, their snakes have stopped rattling, and it's spreading to us. The best theory, and the game and fish guys might know better than I do, but the best theory is they're hiding from the hogs. They have so many wild hogs down there, or whatever they are. And so they quit rattling because they've learned that if they rattle, they get killed. And so they've stopped rattling. And so now we're having all kinds of bites where there was no warning. Somebody was just walking and whack. You know, which is actually indicative of all the vipers, excluding the rattlesnake. No other vipers actually give you a warning at all. They just bite you. And a rattlesnake is a viper, so I don't think it's a huge transition to know that they, are slowing down the rattle. So look, pay attention. Don't just hope that you'll hear the rattle, because you might not. You might not get a rattle at all. You might just get a bite, okay? So, and it's happening. Don't know why, other than...
The younger the snakes are, they don't have control over it, and they release the whole amount that they have. And whereas an older snake, they don't want to release the entire amount of venom, they can control it. The smaller snakes, the ones that are really young, they can't.
I don't know. I'm here in an unofficial capacity, so standing up here, I don't know how. I can't say yes, that's true, or no, that's not, but I can tell you this. The neurotoxin in a younger snake is more potent in general. It's made to be more powerful because they're a younger snake. So it's the actual toxin is stronger than that of an adult. So maybe they don't, maybe they just release it all and due to immaturity and not knowing that could be another threat coming. That's quite possible. I don't know the answer to that. But I do know that the younger snakes, their toxin's very strong. The other thing that's happening is, even though it's a neurotoxin, we have new snakes now, or new developments now, where rattlesnakes are also becoming a hemotoxin. So it's also affecting the blood. So it's kind of crossing that bridge. They're not rattling, and they're neurotoxin, but they're also showing that they have hemotoxic abilities as well. And that's new too, within the last few years. So bottom line, wear boots, and don't go walking around outside at night, especially if it's an area near water where your cows drink or whatever. Pay attention, because that's where they're going to be, especially in this state. If everybody's in this room works in this state, our snakes are going to be near wherever your water's at. That's all there is to it. That's where they're going to be. So if you go out, just pay attention and don't rely on hearing a rattle, because you might not. What about other questions? This is the best way, I think, to teach this class, because it's you guys that are out there, so you guys know what you can come across and what you feel like, but we can also talk about what's normal, what's abnormal, and just make up situations. A head injury? Like if somebody gets thrown or something like that? Absolutely. So in a head injury, there's a few things we're looking for. Immediately, we want to look at their pupils, right? And we want to know a few things. One, we want to know, are they normal size, or are they what would be called blown, like extremely dilated? Or is just one side blown and the other side normal? These are all indicative, those signs, the blown or the one side blown and the other side not, they're indicative of a potential bleed. So that's the first thing you're going to want to look at based on how they landed, is look at their pupils. The other thing is, if they're laying on their back, and presumably they are, and presumably the sun is shining down, shade their eyes and see if their eyes react. See if they get smaller. Does that make sense? Or get bigger, because they'll already be small. So see if they get larger, if they dilate out. If they dilate out, that means that's a good neurological sign. That gives you the indication that they could potentially have a good neurological outcome. If their eyes don't react, or if just one does, that's an indication that we potentially have a head bleed. Okay, that's called ICP, or increased cranial pressure. So if you're concerned about that, some other things that you would look for is your breathing patterns. Your normal in an adult respiratory rate is going to be 12 to 20 breaths a minute. That's normal, 12 to 20 breaths a minute. With somebody that's experiencing signs of a head injury, that goes up, and it also becomes irregular. And they enter this mode called Kussmaul's respirations, which means they'll breathe really, really, really fast, and then they just stop breathing. And they'll go apneic, or stop breathing for 30 seconds, a minute, and then all of a sudden, bam, breathing kicks back in, and they'll breathe really, really, really fast, and then they stop breathing again. And they go on this unregulated pattern. And so what's happening is this part of your brain and your stem is taking over because you're not thinking at a higher function. And so you're entering that caveman response, that your body knows you need oxygen. Neurologically, you're not able to compute to keep that breathing going because you've got the brain injury itself. And so you have this as a safety system. Those are all things you want to look for. If it's not that severe and somebody gets thrown off of a horse and they seem like they're okay, but say 30 minutes later, an hour later, they start to get real nauseous, that's also indicative of a brain injury or a head injury, okay? So you want to call 911 for that. Anytime you ask yourself, do I need to call 911? The answer is yes. You know, I mean, that's unless you feel like you're trained and you can decide if you don't need to. But even when we get there, I've been doing this for more than 20 years. Even when we get there, I don't have x-ray vision. You know, I'm not an MRI. I can just look for the clues and then give you advice based on that. Does that make sense? And that's what we're asking of you guys to do today, is to know what are the clues. If the person acts off, not crazy, but if they can't even tell you what the day is. If they can't tell you what the day or the month is or who the president is, their bell was rung and they need to go get checked out because you just don't know. The injury is called coup, contra coup, or counter coup, depending on your origin. But essentially what happens is the brain is in the skull and it's already tight. There's no space, there's no dead space in your skull. So when the brain, which is almost like Jell-O, in the sense that it will mold, okay, it's collapsible. The skull has absolutely no space for growing, none. So if you hit your head, the brain as a unit slams into, say you hit the back of your head or whatever, the brain slams into the front of your skull, okay, on the front side. The brain itself smashes and takes all of the energy. And then it slams back like a rubber band into the back of the skull or the side to side or whatever, because there's no extra room. Well, the brain, like any other function in your body, will absolutely become inflamed, which means it's going to start swelling. When it starts swelling, there's nowhere for it to go except right back here, out where your brainstem goes in. And that's a big deal. And even a small injury can cause these kinds of problems. So if somebody gets thrown, that's a big deal. They need to get checked out. You know what I mean? And so look for nausea, look for vomiting, look for a change in their mental status. I know the big thing is being sleepy or whatever. That's the old wives' tale. That's important. Don't discount that. But ask them who the president is. Ask them where are they at? Who are you? It's questions they should know without having to think about it. Like, this is the way that it is, If they can't answer even one of those, there's something wrong. If you know them, if they're normal, and normally they could. Now, you don't go ask an Alzheimer's patient, who's the president? Do you know what I mean? You don't do that. You expect to ask the questions based on the person that you're talking to and what they're going to know. Make sense? So, anything else?
Do you let him sleep or sleep it off or keep him awake till you get the medical?
We'll keep them awake until you get to medical. But I mean, it's not, just because they become sleepy, it doesn't mean that that's not a positive that they have a brain injury. But it's better to keep them awake just so you can keep a track on their progress. Does that make sense? So keep them awake and seek medical attention, you know? Yes, ma'am.
What if you need stitches?
What if you need stitches? That's a good question. So if you need stitches, does anybody, vet services in here, anybody like that? Those guys are awesome. Anybody administered stitches before? Yeah? How'd it go?
Well, most of them animals do okay.
Goes okay? It's the same procedure on an adult. I am not recommending that you give adults stitches, but I'm saying it's the same thing. If you need stitches, control the bleeding. Stop the bleeding to the best you can to control that, and then take them into the clinic or whatever. Depending on the area, it's likely not a life threat. But if we're talking about bleeding like from an artery, that's a life threat. That's a big deal. Do you guys know how to tell the difference between an arterial bleed and a venous bleed? Like, we don't worry about veins as much as we do arteries. Pretty much, yeah. Your artery, even down here in your fingers, you have arteries. Your artery, if it's an arterial bleed, it will squirt, even just a little bit, with your heartbeat. Every time your heart contracts, you have an opening in your container. This is a closed container. If your heart beats and it squeezes, a little bit of blood's going to shoot out of there. The closer to the heart you get, the bigger the squirt's going to become. Does that make sense? So if it's right here in your neck and it's an artery, that's a problem.